Mentioned Ontario Premier Doug Ford going to be sitting down with the Deputy Prime Minister. Well, Ford just announced new measures to help stop the spread of COVID-19. He was at a news conference in Ottawa, and the Ontario Premier said this is, quote, a critical time, not just for Ontario, but the whole country. He says Canadians need to have each other's backs. CBC's Megan Fitzpatrick is on the story. We'll see how the premiers and whether they have each other's backs at the First Minister's meeting tomorrow. But what else did Ford say, Megan?
Well, he was joined by Ontario's Health Minister Christine Elliott, and they announced a series of new steps, Suhana, to tackle the spread of this virus, including setting up what they're calling assessment centers. And this is for added screening for the coronavirus. So there will be 6 centers to start, spread throughout the province. They include places like Brampton, Ontario, Scarborough, Ottawa, and a few others. And they do say there'll likely be more to come in the next few weeks for these new screening centers. It's meant to alleviate pressure on emergency rooms and doctors' offices for screening. They're also dedicating more resources to telehealth. We have been hearing stories about long wait times on the phone for people that here in Ontario that are calling telehealth for information about coronavirus. So more investment in telehealth. And then also they say they're increasing the capacity of testing at labs in this province. And then a few other measures like increased public education campaigns, Suhana. They're putting out fact sheets in more than 30 languages, for example. Overall, what we were hearing from Premier Ford and Christine Elliott this morning is that they are well prepared and that they're on top of things. Here's more from Premier Ford.
What I can tell you is that in Ontario, we are planning for every single scenario possible. Every ministry is working together to ensure these plans are up to date and keep us ahead of the situation. And we have set aside $100 million in contingency funding in the upcoming 2020 budget to make sure we're ready for COVID-19.
That upcoming budget, Suhana, is on March 25th. They did reassure Ontarians that they're well prepared, but also a message of this is a fluid situation. For example, that last question to him at the news conference was about people going away on March break next week. If they're coming back from international destinations, should they be quarantined? At this point, Ontario isn't implementing that kind of restriction. Premier Ford saying, go, enjoy yourself, have a good time. But we're monitoring things and things could change, he warned.
What about if somebody is feeling a little bit sick and maybe you have a cough, you're not sure it's coronavirus? People are likely wondering whether they will get paid if they take the advice and stay at home. I'm wondering if you could speak to that, because I do know that there were some health workers earlier today who had some concerns and some urgent requests for the federal and provincial governments. First, begin with them. What did they say?
This is a group called Decent Work and Health Network, and they had a news conference this morning and laid out several demands for the provincial and federal governments. Things like wanting 7 paid sick days for all workers, particularly people that don't have sick days, like precarious workers. They want 10 days of job protected emergency leave. They want employers to drop the requirement to get a sick note or a doctor's note, Suhana, to take advantage or to make use rather of sick days. Take a listen to what one of the advocates was saying at this news conference this morning.
We need to make sure that every patient, no matter what job they have or how much they earn, has the financial ability to follow public health recommendations to stay home when they're sick. Too many people don't have that option. That's why better protections for workers and workplaces are an urgent priority.
So they were kind of frustrated. They're saying we're telling our patients to stay home if they're sick, but they know just the reality for many workers in this province, in this country, Suhana, is that they can't afford to stay home sick. They also were calling for changes to EI. They referenced those changes that were made, that were announced by Prime Minister Trudeau yesterday, waiving that 1-week waiting period, for example. They're saying that's great, but that doesn't go far enough. They want long-term and permanent fixes to the EI system to incorporate sort of newer realities of the workplace these days. A lot of people working in precarious industries, a lot of low-income workers. They're saying a lot more needs to be done. They were quite critical of Premier Ford's government, too, saying that he's been rolling back protections for workers, and that's undermining sort of their advice, and it's putting people at risk, they said.
I know you're watching for reaction and listening for more on those EI sickness benefits. Thank you, Megan.
You're welcome.